Good day, I am Alex Balasa and I'm here to present to you the effect of drugs and alcohol to seafarers in relation to sexual transmitted disease and infection. So first, let's talk about the drug and alcohol. So any level of alcohol consumption or illegal drugs by crew members on board has implication for the safety of the vessel. The crew and any passenger, even small quantities of alcohol have been shown to sufficiently impair seafarer fitness for duty and increase the risk of the accident. The consumption of the alcohol on board ship is being progressively phased out through strict regulation and screening. The majority of the organization enforce a non-alcoholic policy on board the ship, while PSC officer may carry out random alcohol tests on crew members. The adverse effect on the personal health and general safety on board are also compelling reason for avoiding not only alcohol consumption but also drug abuse. A seafarer can expect a little sympathy from their employer or the authorities if caught in possession of using illegal substances. Also, legislation with severe penalties where drug and alcohol are adjusted to have contributed to an accident is being introduced worldwide on increasing scale. Penalties imposed not only cover injuries to personnel and damage to property, but also enormous costs involved in preventing or cleaning up damage to the environment. Report from the United States National Transportation Safety Board quote numerous cases in which alcohol and other drug use has been a factor in aviation, rail, marine, and highway accidents. The Amendment 2010 STCW Convention require administration should put in place adequate measures to prevent drug and alcohol abuse. There is also mandatory requirements for the administration to establish a limit of not greater than 0.05 blood alcohol level or 0.25 mg. L. Alcohol in the breath or a quantity of alcohol leading to such alcohol concentration for master, officer, and other seafarer while performing designated safety, security, and marine environmental duties. The guidelines in the and how can we prevent it by using health check and medical examination, training education, promoting racing and proper prevention, setting safety limits, provision, rehabilitation services, non-discrimination, declaring drug and alcohol abuse with the medical condition, focal point. Also, let's talk about the sexually transmitted disease and infection. Sexually transmitted disease or STD are a serious public health concern, especially in the maritime community. Research has shown that drug and alcohol use increase the likelihood of STD transmission due to reduce the sexual inhibition and an increased risk of unsafe sex practices. Seafarers are particularly at risk for contracting an STD due to the higher likelihood of engaging in risky sexual behaviors and having an increased risk for exposed to infection to the unprotected sex. Therefore, it is important that the seafarer employers consider implementing a policy aimed at reducing the risk of STD transmission in the maritime industry. The following infographic highlights some of major risk factors associated with STD among seafarers and provided tips for reducing the risk of contracting an STD. According to the U.S. Center for Disease Control and Prevention or CDC, there were an estimated 19 million cases of STD in the United States in 2017. More than 3/4 of the reported cases involved the female aged 15 to 24. That's all. Thank you.